The doctors, through clinical integration and a medical management teams, two different committees, will ensure that the treatments that our employees are getting are what we believe, as a medical institution, are best practices, provide the best outcomes. And then utilizing that, leverage that to how we deliver care to the entire community. That in and of itself we think is going to be the biggest dividend of all. And that's where we're hoping to take the program. We are anticipating a fairly substantial hit to our revenue. But we are trying to do everything that we can to ensure that nobody loses their job and that we still maintain not only our competitive edge from employers' perspective, but that there's a strong sense that we do the right things for our employees even when times are tough. So in looking at that, we are looking at some of our benefit plan designs, but not in terms of being a takeaway, but trying to incentivize our employees to use our own facilities. We're looking at continuing our reimbursement of the Weight Watchers program. The smoking cessation continues to be offered at no cost. And what our shorter term goal is to make employees aware. And we are not, I don't believe that we've looked at postponing or changing the strategy that we've laid out for wellness and for the healthy lifestyles initiatives, even though our expectation is that things might get tight, but we believe that this is the right thing to do at the right time. I think if we were to pause this or if we were to postpone this, the longer term implications would be way more costly than to sort of bite the bullet and deal with these issues now. Michael Dowling is our Chief Executive Officer and has been very clear that this is a critical component of how he believes we should be resculpting how healthcare is delivered. But beyond that, all of the senior team, Chief Human Resources Officer, Chief Financial Officer, Chief Operating Officer, are all on board with this. They have weekly meetings internally. We have a bi-weekly clinical integration meeting. We have regular meetings with our managed care area who are looking to leverage what we're doing as us being able to be a provider of choice. We have regular meetings with the system chairman and the voluntary docs, their leadership. But the meetings, while every other week may seem to be a little bit excessive, it's not, because it's keeping everybody on focus, everybody on point, that this is not about a flavor of the day. This is not a program today. This is about making a cultural change that will impact our employees, their families, North Shore as an employer, and North Shore as a provider.